Guys, so let's talk about tremors in this video. So there are 4 types of tremors. Okay, essential tremors, psychogenic tremors, cerebellar tremors which are also called as intentional tremors, and Parkinson's tremors or resting tremors. All right. So firstly, these two are very comparative: essential tremors and psychogenic tremors. So how we need to compare these two are, these both are absent at rest. Okay, so whenever you're trying to work or do some kind of activity, these tremors are going to be activated. Okay, so whenever you're doing something, whenever you're writing something, or just do anything with your hands or with any part, these you're going to have tremors. Okay, and you have to differentiate with distraction. So psychogenic tremors is nothing but a psychiatric thing. That is, your brain is psychologically triggered to have these tremors, right? So these will resolve with distraction. So whenever the patient is distracted, when the brain is not telling you to have these tremors, you will start doing something else, these tremors will be gone. Whereas essential tremors are not going to be resolved with distraction. So we can see in this patient how she's having these facial tremors, right? She's having lip tremors and facial tremors. And this patient has these hand tremors when he's trying to move his hands, right? And look at this. So when the patient is trying to draw with his normal hand, he's able to draw. But when he does it with the affected hand, he's having these tremors, right? So this is nothing but essential tremors. So here we can see psychogenic tremors. Here we can see some psychogenic tremors. So as you can see, this patient is having these tremors on her right hand. These tremors are very similar to what we saw in essential tremors. But if you can see, when the patient is asked to do something with her left hand, like this, her right tremors cease. Because now her brain is stimulated to do something with her left hand. Therefore, they are not, her brain is getting distracted, and therefore her right-sided tremors are stopping. Slow, repetitive movements of the left hand. Right? So this is nothing but psychogenic tremors, where there is ceasing of the tremors when there is any kind of distraction. So now we understood what essential and psychogenic tremors are. They resolve with they do not resolve with distraction, and psychogenic are psychogenic, therefore they resolve with distraction. Okay, they are both absent at rest. So when there is no functioning of the hand, there are no tremors. Whereas now Parkinson's tremors are nothing but resting tremors. So this patient is going to have tremors when the patient is resting. So when the patient's hands are idly kept on his laps also, he might start having these tremors. Okay, but there will be other symptoms as well associated with tremors when this patient is having Parkinson's, right? He'll have bradykinesia, he'll have rigidity, he'll have mask-like faces. So as you can see, this patient here is sitting idly, he's not doing anything, but yet there are some tremors in his left hand, right? When he's closing, there are no tremors, but when he's opening, he's again starting to have these tremors. So those are nothing but resting tremors. And the next one is cerebellar tremors, which are also called intentional tremors. So intentional tremors is nothing but intentionally, like when you're trying to pick something up intentionally, you're going to have these tremors. So what we are seeing in this patient is nothing but finger nose test. So when the patient is asked to touch some fingers and then back to his nose, he's not able to do it. As you can see, when he's approaching the the target, that is his nose or his chin or whatever it is, he's slightly having these tremors, right? So this is intentional tremor, where the patient is asked to do something and he's unable to carry out that function properly without any tremors. You can also see that this patient is having some small, some gait abnormality walking, right? So this is a classic sign of cerebellar tremors. So that patient has some issue in his cerebellum. It could be a tumor, it could be something wrong with his cerebellum. Therefore, he's going to have this intentional tremors. Along with that, he'll have other cerebellar symptoms such as ataxia, nystagmus, or dysarthria. He can also have some any kind of abnormalities. Alright. So as a recap, the patient will have resting tremors in Parkinson's disease when he's having a tremor, when the patient is at rest. There is no function happening. The patient is just randomly having these tremors when he's at rest. And essential tremors or postural tremors, right? So postural tremors, because as we have seen in the video, when the patient is asked to extend both his arms, he's having these tremors. right? Ask the patient to extend his arms, and then he's going to have those tremors. An action tremor is nothing but seen in cerebellar disease, also called intentional tremors. So these are when the patient is being asked to do something in specific, like ask the patient to touch your finger and nose repeatedly. So that's when the tremor is going to be seen. So postural tremors, that is essential tremors, are also seen with salbutamol as a side effect, okay, and also seen in alcohol withdrawal. And psychogenic tremors have an abrupt onset and spontaneous remission, and they decrease when the patient is distracted, like we have seen in the video, and there are no neurological signs. So this is a psychogenic issue, therefore there won't be any neurological signs. So that's all about tremors. Thank you.